This is Amend and Progress, your go-to podcast from Vidori for all things promotional material review. Get ready for actionable insights, valuable perspectives, and best practices to elevate your workflow and team morale.
Hello, everyone, and welcome to Amend and Progress, Vidori's podcast about the material review process. I'm your host, Annalise, and today we're going to be talking about content operations and specifically how to achieve excellence in this area of content management. This episode is going to be great for content managers or really anyone at your life science organization that interacts with content. Joining me in the conversation today is Alana Goodman, Program and Operations Lead at Decisive Consulting. Alana, welcome to the show. So nice to have you here today.
Thank you so much for having me, Annalise. I'm so excited. As you know from our conversation prior, this is an area that I am passionate about. So I'm really excited to be here with you.
I'm so happy to hear that. I am so excited to dig into that passion and just uncover all of this knowledge that you have in this content area. But before we get there, would you mind just introducing yourself, telling the folks, the listeners and watchers out there just a little bit about you?
Sure. So I actually started my career in 2011 in life sciences. And in that time, I worked through 10 product launches in a variety of therapeutic areas, really focused on the intersection of strategy and business operations in life sciences. I specialized in 10 content ops launches around a comprehensive and holistic approach to what people, have called MLR, PRC, MRC, CRC, right? And looking at it and saying, how does this process impact my launch? How does this process impact my strategic planning? And really taking a look at that. And so I've taken that skill of, intersecting operations and strategy and joined my mentor actually at Decisive Consulting in the UK. And I've brought that sort of high level, let's get all the puzzle pieces together to have a stronger impact. I am building a program over there for her in JCA readiness assessment and organizational transformation. But I am so excited to really have a conversation about something that I have been passionate about since I touched it in 2011 at Biogen, which is content operations and the evolution and impact that it can have on strategy within your organization. It is such a fun topic. And I have so many amazing people in my life that are also passionate about this, one of which I think is joining you in a couple weeks as well. So
Yes.
This is just like the best topic. So what questions can I answer for you, madam?
I love to hear passion about the topic up top because I think so often this is one of those things that's ho-hum. It's part of the job, right? It's just happens
a necessary evil, right?
Totally.
I think a lot of stakeholders in the process look at it as a necessary evil. In order to cross all my T's and dot all my I's, I need to make sure I go through the MLR review and my medical legal regulatory reviewer signs off, and then I can use my piece. But it's going to delay my marketing. It's going to cost me a lot more with my agency because I'm going to have multiple rounds of reviews. I'm going to have, disconnect between the reviewers. The reviewers are switching, and now I have a new reviewer for a new round. It gets so personal. And it gets so much to the heart of what a marketer is doing or a medical person is doing when creating a piece. And there's so much emotion tied to it because there's so many hours away from their family to make this, right? And so they want it to go well and they want it to have impact in the patient population. And here comes MLR saying, you're not following the process. You didn't do this. You're not filling out the right information. And this person is like, I just want to help someone get my therapy. Can you please just approve my material? And they're like, we want you to do that too, but we want you to do it compliantly. And so it's saying the same thing. It's just in different languages entirely. And it's bringing it all together is, I think, the role of operations in this particular space.
Yeah. Where does your passion for this come from? Like, is there a project that really engaged you in this area? I'm just so curious. What is it about your experience in industry that drives this passion for content operations?
It's the people. So whether it's the patients that the material is supposed to educate or the HCP that the material is supposed to educate, I always felt like I wasn't that far removed from having a direct impact on a patient's life. And I have really, really committed to something that happened I don't know, I think it was in my first couple months at Biogen. They had a lunch and learn. They had a patient advocate come in. He was diagnosed with ALS. He was in his early to mid 30s. He was already wheelchair bound. He had 3 little kids. I think they were all under the age of 10. He had only recently been diagnosed with ALS. At the time, Biogen was working on a product or a therapy to see if they could support the ALS community. And unfortunately, that particular product didn't move forward. But this patient looked out at the audience after he shared what it was like to lose his ability to walk and to learn that he was going to die. And he looked out at all of us and he said, every single one of you matters. What you do makes a difference in the lives of your patients, whether you're the janitor or the CEO of this organization. And it literally right in my heart, right? And then years and years later, I became a mom, and both of my children are special needs and they require a lot of different support. And my younger one was a preemie, and we depended very heavily on the medical community to support him. And so you are just not far removed from being on that stage at any given point in your life. And so what we do in this industry is really important, and how we get that message out is really important. And so for me, content ops has always been a way to support the patient. And very much on the Decisive side, I have the ability to support market access in the European region now. And I've been able to take that passion for patient advocacy and access right on the content side and actually put it into motion to support the pricing of therapies within that organization, right? Like, it's just really, and we are not far removed. What we do has a big impact. And it starts with getting the message out.
I'm candidly a little speechless, because creating that connection between what we do and the bigger story, the bigger outcome, what we're all trying to achieve together. I think that story is like an eloquent, perfect representation of course, your passion for this, but a good reminder for all of us on what is at the other end of this work, and really what is the point and the purpose. And there is a great purpose and point to it. And so I just think that's such an eloquent way to put it, and what a beautiful story to incorporate into the conversation. So thank you for sharing that. Wow. So let's talk about your definition of holistic content operations, because I know just from our pre-interview conversations, I've read a lot of the articles that you've put out on LinkedIn. You've written about this in the past. You have a strong perspective here. How do you define this, and how perhaps does your definition vary from how organizations traditionally think about content operations?
I think this stems all the way back to when I first joined life sciences in 2011. Operations had just split from a centralized function in the industry to commercial ops and medical ops. And at that juncture, you needed to figure out, how to support 2 separate entities with a firewall and all the compliance and technology, is relatively new in our industry. We're slow to move the needle here in terms of process and technology innovation. And so, we've evolved to omni-channel, right? We went from just like emails, and then we went to multi-channel, and we had websites, and nothing was really, and now we're in omni-channel. And I think this is the opportunity that the industry has to cut costs and not people, and look at it holistically, right? So you've got this omni-channel opportunity that is generating a boatload of data, and everybody wants access to that data. When is something open? How many times is it open? How much time do they spend on a certain page? Did they click the link that you wanted them to click? Like, is your call to action in your piece strong enough to generate activity in the piece, to generate data, right? And the thing that I think people forget in the firewalling is that the data itself doesn't need to be firewalled. The intended use of the data is what creates a privacy or firewalling situation. And it's a nuanced view of the data, right? But if you look at information, it can be used for a commercial perspective, and it can be used from a medical perspective. In addition to that, you have to look at, if I'm launching a product, or I'm launching a new indication, or I am launching a new campaign, or I'm doing my biannual or twice a year POA planning with my fields. Like, these are all points at which a bolus of information is being collected and sent through the process, and then sent out for use, whether it's with the field directly or for the field to use with an HCP. And so now, as this starts getting like bigger from the omni-channel, we've got all this data, and now we've got marketing tactics, and now we're into the process and technology and the weeds of it, right? In the weeds of it, you have so much information. You've got medical affairs materials, you've got commercial materials, and in commercial, you've got marketing, you've got market access, you've got, in medical, you've got HEOR, you've got medical writing, you've got medical information. Like, there is just so much information, right? But then you also have to take a step back from that and say, great, congresses, they generate information. Your booth has to be reviewed. All your materials have to be reviewed. Any meetings you have set with HCPs externally that are being shared with multiple HCPs, even if it's on a one-to-one basis, needs to be reviewed at a Congress. So like that's generating material. Then you're looking at, are we having a symposia at the meeting, right, at the Congress? Well, that generates material. And then are we using the time to bring advisors together for an ad board? And some companies, that generates material that needs to be reviewed. And now you're talking modular content. Now we get to modular content, and we're looking at modular content, and people are saying, ooh, modular content's going to save us time and money and efficiencies. Sorry guys, it's not right away. It just isn't. Like, it is a unicorn. We won't even get into it, but in terms of modular content, the amount of volume that is going to come out of that is going to crush MLR, and not just MLR, but reg ops too, because every single one of those pieces in the US needs to go down on 2253 to the FDA. So you're not even killing just your reviewers, you're now killing your back office operational functions that are sending your OPDP documents in via, the electronic portal. So it is such a large impacting activity. And so my recommendation is that we as an industry need to shift from thinking about things in a silo and actually look at content ops holistically. Speaker programs, congresses, events, HCP engagements, whether that's a one-to-one with a field member, and that could be, sales fields, that could be medical, it is creating the same overarching strategy. So, my KPI for this campaign is advocacy or education, right? So then there's education as the overarching umbrella. But now commercial and medical have a synergistic message around education that now we are planning our materials to support, which go up to the ultimate umbrella of education, which is now driving more information to that specific hub or domain, right? And so there's just all of this stuff that people are missing in terms of the interconnectivity and web that content ops actually touches. Your technology, your CRM, your review material, your digital asset management. If you are doing modular content, you need an authorship tool. Like, from one end to the other, you need to look at everything. And people still, and I have talked to very large pharma clients all the way down to emerging pharma, still do not grasp and are in analysis paralysis around the evolution of material. And we are waiting so long to make a decision on what comprehensive content ops really should look like, that by the time we make a decision, natural language processing is going to have us all sort of revisiting what the heck content op means again. And that's coming 3 to 5 years maybe before, life sciences start saying, hey, AI, can you create a marketing campaign that does X, Y, and Z? And can you make sure that it meets, this regulation and this guidance? And can you please make sure that it highlights spots in which you're going to need human interpretation? Because it's not a black and white thing that can be programmed in. So content ops, it is a very large, complex function that generates a ton of data that people have not looked at as an opportunity to figure out, is it the campaign? Is it the channel? Is it, what's working, what's not working? Well, you know what? If everything talks, and we plan together cross-functionally as a team and not just in departmental silos, and everybody has a seat at the table, including operations, the needles that could be moved would be unreal. If we want to do this, it's about bringing us together. It's not about cutting and ripping things apart and automating. It's about smartly choosing what pieces come together to create the story that you're trying to tell.
I think the complexity is a big thing that I want to definitely, tap your brain for, because I could imagine that this is overwhelming to some. If you have not taken this approach in the past, this could be overwhelming. Where do I start? So we're going to get to that. But before we get there, it sounds like the fulcrum of all of this is a content strategy. Would you agree? Or what is the core of the core of holistic content operations that should be driving all of the things you just talked about? Because there's layers, there's connectivity, there's this web. My interpretation is this is a content strategy, but curious to get your thoughts.
So I agree to an extent it is content strategy.
Okay.
But I think it's actually a little bit bigger than that. I think it's actually knowing what your why is for every activity. Why am I doing this? So, for instance, if you're going to a Congress, why are you going to the Congress? Are you going to launch a new program? Are you going to advertise that you exist? Are you going to show a new innovative technology? Because that's going to change the structure and what you put in your booth. Right? It's going to change everything. Because if you're announcing that you exist, you want it to be a welcoming environment in your booth where it's vibrant, it's drawing people in, it is having fun, it is laughing, it is loud, it is, right? You're going to set that up differently than if I am launching a program on X, right? That's going to be all about that program, and it's going to be more strategic. It's going to be, call to action, it's your, if you will, claims around your program, right? You're going to build your booth differently to that. So it's the why. What am I trying to do? Am I trying to announce something? Am I trying to, generate revenue? Am I trying to prepare people for the launch of something? Am I, what is your why? And then let's work backwards from that. Because I can tell you that if you are just trying to get the word out, then it is quantity in volume and style and channel and language, right? If it is, I want to have a patient community develop, that's going to be targeted and soft language and warm and right, like, and you don't need to bombard people because it's relationship based, so you're going to be having conversations as opposed to materials. So what you would focus on more is an FAQ. So it's not necessarily a content strategy so much as identifying what you're trying to do and why, and then work backwards from there as a team. Not just commercial sitting down with the MLR reviewers and saying, all right, this is what we want to do. We're going to have 14 concept reviews. We're going to have, 3 congresses this year, 2 ad boards, and 2 new campaigns. Great. Why?
Right.
Like, just tell me why so that I can now help you say, okay, but you know what? I think in my experience, this would be a better target. And let's look at the data around the last campaign that had the same approach and see what we should change.
Yeah.
If you don't include people, or medical could say, hey, we tried that language. We tried that language. It didn't work.
Yeah,
right?
You're aligning everyone under this vision that provides context, guidance, collaboration, all focused on this ultimate goal. So it's hugely helpful in context setting, but also we talk about, just alignment of these teams early. And we always hear from Med Affairs, just include me early.
Just talk to me.
I can help guide, right? I can help provide my feedback. You don't have to do, and so I think this concept of the why is extremely helpful for folks to think about, because it's that alignment setting up front that then guides all of the supplementary activities that you talked about. So I think that's extremely helpful. Yep.
Exactly. And I think, as part of this, Annalise, it is so incredibly important that team camaraderie and rapport throughout strategic planning. And this whole process where you determine what your why is and how to weigh that you are meeting that why. How am I measuring that why has been sufficiently supported?
Mm-hmm.
And it's everything. It's training, it's culture, it's system setup, it's user experience, it's leadership involvement, it's line of sight, it's proper communication, it's development of the younger team members, right? When they're trying to figure out how to keep a meeting on track, or you have a younger reviewer going against a senior director marketer, and then they're not seeing eye to eye, giving them the support, right? And developing them to teach them how to handle that situation well, because MLR is, like I said, it's personal, but it's also one of the most amazing in the trenches experience with people when you're launching a product. It is, if you can figure out a way to get a team on the same page and really jiving with one another, it is one of the most amazing experiences to go through what I call launch party, which is that like week of just kind of being stuck in a room approving materials. But I feed them a lot of feeding, a lot of laughter, a lot of breaks, a lot, right? But it is creating an environment where appropriate disagreement can occur and people can grow and learn from it. And those launch parties are an amazing example of teams coming together and figuring out ways to compromise in ways I've never seen other functions do.
Yeah.
It's a really special function, MLR.
I mean, I am lighting up hearing you talk about it as special, because like we said at the top of the episode, there's this necessary evil. Cloud. over it, right? And it doesn't necessarily have to be that way. And you're breaching on a topic that we talk about a lot, is that MLR is made of humans. It is a human process. And so I'm curious because, improving collaboration within this team, working better together, talking through those disagreements, being okay to have disagreements, teaching one another. Like, there is a whole underbelly of human collaboration and interaction that sits underneath MLR. Is there something in particular that you've seen work well to bring teams together besides, I think, the why, defining the why and aligning under that is a perfect example. What else helps this team gel?
I have worked with some companies as a consultant and as an FTE where operations was not viewed as a strategic partner, and they were just reviewed and viewed as administrative support that did my bidding. And that is not the way I set my ops teams up, because at this point in the industry, if I can't show return on investment for a new process, a new technology, a new head count, a new whatever, I don't get it in ops anymore. Like, the industry, if you can't show me that you're returning investment, I can't invest in it, because R&D is just so damn expensive and resources are just so expensive, right? But creating this space where ops is valued because you show return on investment, I think is really important. And so I never hired for skill set. I hired for personality in every instance of bringing someone onto my team. And I could tell if someone would work or not work within 5 to 10 minutes of my time with them pretty quickly. And there was one girl who 2 of my team members were like, I don't think so. She's really quiet. I'm not sure she's going to be able to do it. I said, here's my card. Take her to lunch. I disagree with you. If at the end of lunch you don't agree, I will make the offer to the other girl. But my gut tells me that this woman is the woman. And so I gave them my card. They went to lunch. She loosened up because she got comfortable. Because I think if you break bread with people, it is important. I always have like quarterly events for my content ops function where I bring everybody together, the marketing teams, the medical teams, all the reviewers, any agency that wants to attend. If we have, contractors that are supporting our system, they're there. I always had leadership come and open up the like snack time, a happy hour thing, and say, we're really glad you're here. We appreciate all of your efforts. But I had them break bread, and she loosened up, and she was one of the best hires that I have ever hired. We still stay in touch now. She followed me to another company. She is someone that I both adore on a personal and professional basis. And, she has shown so much growth from MLR. She's moved on from content ops directly to, one of the other areas that content ops supports in a leadership role. And she's doing phenomenally. And that opportunity was given because she was able to break bread. So I think it's creating opportunities for your walls to come down so that people see each other as human. I actually did a magician once for during COVID. During COVID, I brought it, and that was the one that everybody loved, right? I did a murder mystery for the holiday. Everybody got a character and they had to dress up, and I gave out awards for the best dress, the most into the character, whoever guessed the murderer. Like, we just had fun, and we ate together, and we talked, and we saw each other as human, and we gave each other chances, and we gave each other grace. And I think that is why content ops is so special, is that when you can relate to one another on a human level, you can move mountains in this space.
getting to know what there's power in getting to know one another, the human level. And I love the break bread because what greater common denominator for human beings than food?
Right?
Come on.
I'm Italian, so like food answers everything.
I'm right there with you. I think that's fantastic. What a great best practice to follow is break bread. I absolutely love
Break
it.
bread. You guys are arguing, bring in a snack. My husband and I do it too. If we're arguing,
There you
we'll
go.
be like, when was the last time you ate?
Yes. It's so
Literally,
true.
literally.
So
Okay,
true.
let's pause this and eat something and come back. And then you're like, oh, oh, I'm not mad at you anymore. That was really stupid. I don't know why I'm so annoyed. I clearly was hangry. It really makes a difference.
There you go. Yes. Okay, so Alana, I mean, I have so many questions I would love to ask you, but I'll just ask one more because I want to be respectful of your time today, and that's I sort of alluded to this when you were talking about your sort of definition of holistic content ops. For a company that has not done this, where do you start? What are some like baby steps? Maybe there's the crawl, walk, run approach. For someone that has not done this before, where would you advise them to start?
I think there is the ability to do things without big, huge technology companies. If you're really, really tiny, like you don't need anything enormous, right, guys? Like you just need structure, you need an ability to share information, and you need an audit trail in case somebody ever does something wrong with the material or leaves the material behind and it ends up in the hands of, an FDA person at a Congress and they're like, anybody? Right? Like you
Yeah.
need to be able to figure that stuff out. So start simple, just create structure, create a, simple set of parameters. You need this many days between the time you submit and the time that the reviewers have to complete their review. And be realistic, guys. I just implemented a process for an emerging pharma company, and the medical reviewer literally said, I need one more day. I just don't think I'm going to be able to do everything on my plate and do, my content ops review. And I was like, oh God, as the contractor putting this all together, I'm like cringing, waiting for marketing to just be like, yeah, well, too bad. And the head of marketing for this company said, if that's what you need, that's what you'll get. And so it is advocating for what you need right from the very beginning, whether it's marketing or a reviewer, and it
Yeah.
is respecting that request. Because they're ultimately, if you are planning for 5 days and they always need 6, you're always going to be late in your calculations. You're always going to be over in your timelines with the agencies. So just be realistic, and do what you can do, and make sure that if you are making claims, you are supplying the references that back that up, because that's going to slow it down too. I think those are really the biggest, tips I give. Easily,
Yep.
Reused and found is really great. And you can do that in your file saving system if you use tagging. There's very simple things that can be done on a low cost way. And it's bringing in someone who knows how to kind of put this together and say, all right, what is your overarching goal for the next 6 to 12 months? What's your next goal at like 18 months to 2 years, right? Like how close are you to readout? How close are you to launch? Those are all things that kind of weigh in on the approach that you can take. I mean, you can certainly go to one of the big consulting companies and say, I need everything, I need all the bells and whistles, but you really don't. If you don't have more than a couple products, you just don't.
Yeah, we often talk to our customers about that business context and just scale as possible, but the business context at that early stage is so critical. So
It
that
really
aligns with
is.
sort of our experience there as well. Well, Alana, thank you so much. This has been incredibly interesting. Just appreciate like your insights and unique perspective on this. I've just thoroughly enjoyed the conversation. So thanks for coming on.
Thanks so much for having me and listening to my perspective. I appreciate it. This is so much fun, Annalise.
I'm so glad to hear it. Thank you. And everyone, the conversation doesn't stop here. Follow Vidori on LinkedIn. We're doing updates on new episodes. Ask us questions. If there's a episode you love or a topic you want to hear about, please let us know. You can subscribe to Amend and Progress on YouTube, Apple, Spotify, or wherever you get your podcasts. If you like today's episode, rate and review us. Until next time, this is Annalise signing off for Amend and Progress. Have a fantastic day.